Have you ever had to choose between paying your medical bill and buying groceries? For millions of seniors across America, that's not just a difficult choice. It's their everyday reality. From skipping doctor visits to splitting pills in half just to make prescriptions last longer, this silent crisis is putting the health of our elderly population at serious risk. Before we dive deeper, please take a moment to subscribe, like this video, and share your thoughts in the comments. Your support helps us keep creating valuable content for seniors and their loved ones every week. Now, let's uncover why so many older Americans are skipping medical care and what can be done about it. 1. The reality. According to a report from the Kaiser Family Foundation, nearly 1 in 4 seniors in the United States skip necessary medical care because of cost. That means millions of older adults, many who worked hard their whole lives, are unable to afford doctor visits, treatments, or even basic medications. It's heartbreaking to imagine, but for many seniors, even with Medicare, out-of-pocket expenses keep climbing. Between rising prescription prices, expensive co-pays, and gaps in coverage, medical costs can eat up a large portion of a retiree's fixed income. Imagine living on a $1,500 monthly Social Security check and getting a $400 medical bill in the mail. For some, that bill means skipping a doctor visit. For others, it means going without food, electricity, or rent. 2. The cost barrier. Let's break down where the biggest expenses come from. First, prescription drugs. According to AARP, the average senior spends over $6,000 a year on medications. Even with Medicare Part D, there are still coverage gaps, what's often called the donut hole. Many seniors fall into this gap, where insurance temporarily stops covering their prescriptions, leaving them to pay full price. Next, medical procedures and hospital visits. A simple emergency room visit can cost thousands of dollars, and that's before any tests or overnight stays are added. Some seniors avoid calling 911 or visiting the hospital altogether because they fear the bill more than the illness. And then, specialist visits, like seeing a cardiologist, a doctor, or a physical therapist. Even with insurance, these visits can come with high co-pays or uncovered services, forcing many to delay treatment until it's too late. It's not just about affordability, it's about survival. 3. Emotional and physical toll. Skipping medical care doesn't just hurt the wallet. It affects both mental and physical health. Many seniors develop chronic conditions like diabetes, arthritis, or high blood pressure that require consistent monitoring. When these conditions go unchecked, they lead to emergencies, hospitalizations, or even death that could have been prevented. But there's also an emotional toll. Seniors often feel ashamed, helpless, or invisible, like their health doesn't matter anymore. This emotional stress leads to depression, anxiety, and a loss of hope, which can worsen their physical state even further. If you ever felt frustrated by medical costs, you're not alone, and your story matters. Tell us in the comments if you or someone you love has faced this challenge. And remember to subscribe and like this video if you believe seniors deserve affordable health care. Your voice helps us reach more people and bring awareness to this issue. 4. Why costs are so high. So, why exactly is health care in America so expensive for seniors? 1. The insurance gaps. Medicare doesn't cover everything. Dental, vision, hearing aids, and some long-term care services are often excluded. That means seniors must pay out of pocket or buy supplemental insurance, which many can't afford. 2. The the rising cost of prescription drugs. Unlike other countries, the U.S. government doesn't regulate drug prices directly. That allows pharmaceutical companies to set their own prices, sometimes charging 10 times more for the same medication found abroad. 3. Hospital and administrative costs. U.S. hospitals spend enormous amounts on administration, billing systems, and insurance paperwork. All those layers of complexity add up to higher bills for patients. 4. Lack of price transparency. Many seniors don't even know how much a medical visit or procedure will cost until after it's done. That uncertainty makes it hard to plan and easy to avoid care altogether. 5. Inflation and living costs. Even as Medicare premiums rise yearly, Social Security checks often don't keep up with inflation. This leaves seniors struggling to balance food, housing, and medical expenses with limited income. It's like trying to fill a leaking bucket. No matter how much you pour in, it keeps draining. 5 real stories. Let's look at what this crisis feels like in real life. Case 1, Mary, 74, from Florida. Mary has diabetes and high blood pressure. Her medications cost nearly $400 a month, even with Medicare. To save money, she takes her insulin every other day and now faces severe complications. She told a reporter, "I worked all my life, but I can't afford to stay healthy." Case 2, Robert, 69, from Texas. Robert's heart condition requires frequent specialist visits. After just 2 appointments and a few tests, his out-of-pocket bill was over $1,200. He decided to take a break from care for a while and ended up hospitalized months later. Case 3, Linda, 80, from Ohio. Linda's Social Security income barely covers rent and groceries. When her dentist told her she needed urgent dental work costing $2,500, she simply said, "I'll wait." She's been waiting for 2 years. These stories are not rare. They're the reality of countless seniors who quietly suffer behind closed doors. 6. What can be done? While it may seem hopeless, there are steps that can make a difference. Look into Medicare savings programs that help pay for premiums and co-pays. Ask doctors about generic alternatives for prescriptions. They often cost a fraction of the price. Use community health centers or nonprofit clinics, which offer sliding scale fees. Advocate for policy change. Write to local representatives or join senior advocacy groups. Your voice matters, and it's one of the most powerful tools for change. If you found this video insightful, or if you care about improving the lives of seniors, please take a second to hit that subscribe button, like this video, and leave a comment below. We'd love to hear your experience. Have you or someone you know ever skipped medical care because of cost? Every comment helps raise awareness and reminds others that they're not alone in this struggle. We release new videos every week on senior health, longevity, and financial wellness. So make sure to turn on the notification bell to stay updated. Because at the end of the day, no senior should have to choose between their health and their wallet. Together, we can bring attention, compassion, and change. Thank you for watching, and until next time, stay strong, stay informed, and stay healthy.